Good morning. We'll start our press conference. I'm George Latimer, Westchester County Executive, and I'm joined by Dr. Shalita Amla, who's our Commissioner of Health. And we're here to give an update on where we are with the monkeypox outbreak in Westchester County and our strategies for dealing with it as we go forward. We'll cover a certain amount of ground, and then we'll open it up to the press in the room, and then those press that may be following remotely by contacting us directly. Let me just outline what we're going to try to cover in this. We're going to talk a little bit about what some of the numbers are. Then I'm going to ask Dr. Amler to describe what monkeypox is vis-a-vis COVID. And I say that because we're still in the middle of the COVID pandemic, and COVID protocol is very much on our minds. What has happened to the society because of COVID is dramatic, and I think we need to identify how monkeypox differs from COVID, and Dr. Amler will outline in general terms what that is. We'll then cover a couple of basic topics: testing. We'll talk about vaccinations. We'll talk about efforts to obtain resources for Westchester County residents, and then the outreach we're going to make to any of the affected communities. So we'll get questions and hopefully have done as much of an update as we can. As we are here this morning on Friday, July 15th, it's our understanding that there are 1,470 cases of monkeypox confirmed nationwide. Of that number, 1,470, there are 414 that are in the state of New York. So New York is the largest of the states, California, Illinois behind them. Generally, the numbers of cases follow population. New York is not the most populous state, but it's in the top 4. In Westchester County, we have 12 cases of monkeypox that have been confirmed as of today. The statewide number 414 is made up primarily of New York City cases, and they have 389 cases. So 389 cases in the city of New York out of the 414 in the state, 25 outside of New York City. 12 of those 25 are Westchester County cases, and there's some in other counties as well. It's important to understand that of all of those cases, there have been no fatalities nationwide. No fatalities nationwide out of the 1,400 cases. That's important to understand. When we dealt with COVID, we dealt with an illness that did trigger fatalities. The second thing is that all of the cases in Westchester County are individuals, while having tested positive for monkeypox, are recovering. And so we believe that those who are identified today as having the disease will recover. It is a painful disease, but it is not necessarily a fatal disease. So as I said, I wanted to draw the comparison, not because there's intrinsically a comparison, but because all of us are going through a whole set of things that we think about in terms of COVID. And I want to differentiate that right off the bat. So when we talk about testing, and people start to mentally compare it to what's happened in COVID. When we talk about vaccinations, they mentally compare it to what's happened to COVID. You have a frame of reference. Dr. Shalita Amla, who is a pediatrician by profession, has an advanced degree in public health, has headed the health departments down two New York State counties, Westchester being her current assignment for over a decade, has really led us through the COVID crisis with medical advice, and now she's here with us to talk a little bit about the differentiation between monkeypox and COVID. Dr. Amler.
Thank you. Okay, so let's start by saying, and we all know that COVID is spread by respiratory droplets, and so that's why we've been asking everybody to wear masks for quite a while now. But monkeypox is spread differently, and you don't need to wear a mask for monkeypox. It is primarily spread skin to skin. So contact with a person who has a sore or a rash could, if it was monkeypox, spread the infection. Or contact with objects such as clothing. If a person has had lesions and maybe they were weepy, the clothing could become contaminated, and if you touch the clothing, you could get it that way, or bed linens. Monkeypox really spreads less easier than COVID, and in fact, it was discovered about 50 years ago, and as you know, we've had almost no spread of of monkeypox in the last 50 years, and in general, the cases were mostly confined to the continent of Africa. Remember that COVID can spread simply by talking with a person in close proximity in a room. So, you don't have to touch them with COVID. We could be in this room, and that's why we say, wear a mask and you keep social distancing 6 feet apart. That is not true of monkeypox. So it's really a disease where its primary mode of transmission is skin to skin. What are the symptoms? So I think we're all very familiar with the symptoms of COVID, fever, cough, respiratory symptoms, shortness of breath. But monkeypox, although you can have a fever with monkeypox, the symptoms are more like an intense headache, swelling of the lymph nodes, muscle aches, and an unusual rash that can blister and crust over. The rash tends to be on the face, the palms of the hands, the soles of the feet, in the mouth, or around the genitals. Monkeypox illness typically lasts for about 2 to 4 weeks and does not usually, as the county executive, cause serious disease. And in fact, in the United States, there have been no deaths related to monkeypox. It can be a little bit more serious in people who are immunologically compromised or young children. So how do we test? As the county exec alluded, the tests are quite different. With COVID, it's a respiratory disease, so we're swabbing the nose. With monkeypox, we are swabbing the rash. So with monkeypox, there's no way to test unless you have the rash, and then a cotton swab is run across that and sent off for molecular analysis. Vaccines. We have vaccines for both COVID and monkeypox. The difference being that they are different vaccines. They are specific to the diseases that are being treated. Both are generally FDA approved. With monkeypox, the vaccine we're using here in New York is called Genevus, and it is FDA approved. It is only for individuals who are over the age of 18 years of age. It is not approved for anyone less than 18 years of age. But what is unique about this is that if you have an exposure to monkeypox and you get the vaccine within 4 to 14 days after your exposure, you may potentially prevent the disease, or if you have the disease, the symptoms may be less severe, which is what we all hope for. I just want to say that I think we should not be alarmed, but we should stay informed about monkeypox. This means understanding the symptoms, how it spread, and what to do if you're exposed. And so I think that being knowledgeable about this is the most important thing that any of us can do at this point. Thank you.
Thanks. Thank you, Dr. Amler. Why don't you stand over here in the shot? So just to go through some basics for everybody's benefit, understand where we are and the game plan that we have at this point. And everything we're doing now is subject to the change that inevitably occurs in all of these things. If situations change, then we will change strategies and amplify certain things. Right now, as far as testing is concerned, the first step in this process, as Dr. Amler said, this is not a disease that is asymptomatic and you don't know if you have it or you don't have it, so therefore you want to test to find out that you have it. The testing begins when a symptom manifests itself. So that's fundamentally very different from COVID, and that changes the format of testing. There is no at-home testing for monkeypox, and there is no group site testing for it. So what we did when we were testing for COVID, whether it was a drive-through test in Glen Island or the original testing model in the county center, wouldn't apply. You would have a symptom, you'd have the rash or lesion or something of that nature that would have you believe that you potentially had monkeypox, and then you would test at that point in time. And what you would be expected to do is reach out to your medical professional. If you have a medical doctor, a medical doctor's practice, you contact a local hospital, then you would go to test at that point in time. And as Dr. Amler said, the testing is a swab of the rash or of the lesion, and then it's sent to a medical facility to determine if you do have monkeypox or not. There is no testing clinics. Therefore, what we have thought of as the county's public health responsibility to go out and test isn't the prior way to handle this. We move to the vaccination phase, for which there is a county public health function and activity. Now, the resources that we get do come through the state of New York. And I guess ultimately through the CDC. I've noticed that a number of state legislators and New York City council members have petitioned the federal government, the CDC, to work at providing more vaccination doses available. And of course, we've seen New York City open them up to the public a couple of weeks ago, and they had the first allocation of it. At present, only 5 counties outside of New York City have been given an allocation of vaccine. We received a tranche of 420 doses recently, and we expect 450 doses recently. We expect to have 520 doses also available to us. In terms of the doses that we initially received, the 450 doses, our strategy has primarily been to provide them to those medical facilities, hospitals and in one case, neighborhood health centers, that would be the point of contact for a person who came down with symptoms and then went to be checked to determine if they had the disease or not. We have a graphic that shows that of the 450 doses that we received previously, Westchester Medical Center received 100 of those doses. St. John's Riverside Hospital, through their Hope Community Center, they're based in Yonkers. We had an allocation to Open Door Family Medical Center, which is headquartered in Ossining, but also has operations in Portchester, Sleepy Hollow, Mamaroneck, and some other places. And we have reserved 50 doses for the Westchester County Department of Health, along with an additional allocation of 520 that's coming in, which will lead us to beginning our clinic vaccination process, which will start this coming week. On Monday, the 18th of July, we will open up for appointments at the county health clinic located here in downtown White Plains at 134 Court Street. That is where the vaccinations will be administered from 12 noon to 3 p.m. starting this Monday. And then on Wednesday from 4 p.m. to 7 p.m., same location, White Plains Health Clinic, 134 Court Street, that portion of Court Street between Corropus and the Post Road. We will administer vaccination doses based on appointment only. And you want to call the County Health Department, which is 813-5000, I believe. Make sure I get the right number here so we're correct. And there will be a referral to the proper individual who will take the appointments up until we exhaust the supply that we have available. That's 914-813-5000, the Westchester County Department of Health, for appointments. And since we have a 2-dose protocol, whenever you get the vaccination, then you'll have to come back 28 days later to get the second shot. The doses that we're referring are 2 doses provided for each. So if we have 420 or 500, that will satisfy 420 or 500 individuals because of the 2-dose reality. But they'll have to come back, we've been through this before, for a second shot 28 days later to reinforce, I guess, the first shot. We currently have allocated 90 units, 90 doses for New Rochelle and Mount Vernon residents, and we're working through the Montefiore Health System, which has Montefiore New Rochelle as a hospital, and they have a facility in Mount Vernon, the former Mount Vernon Hospital, and trying to work through exactly how they would be able to deliver those doses out there. So with presence in the center of the county, Westchester Medical Center, in a couple of our villages through Open Door, through White Plains Hospital, Yonkers, Mount Vernon, New Rochelle, we're targeting the major population centers at the level of resources that we have. We've reached out to New York State. We've indicated that we will, as we did during COVID, effectively administer as many doses as there is demand for in Westchester County, and we will do that efficiently through the resources that we have in our medical partners, as well as that which we do through our own health clinic in White Plains. I want to highlight again that appointment only is what's necessary, and it is important to understand that as much as there may be concerns that people might have the disease, the testing only begins when you have an example of the disease's symptoms affecting you. So it's a very important difference here. The exposure, 14 days or fewer. Now, there are those individuals that are in certain vulnerable social circles. We recognize that this is a skin-to-skin disease, not airborne disease, and it generally ties into intimate contact. So individuals, who know whether or not they have reached that particular circumstance would then have reason to think that they may be exposed, and then would want to consult their medical professional to be sure that they have a proper checkup, also to eliminate other possible issues that might arise in a person's health. That process has led us to target outreach to certain vulnerable populations, and today we have a conference call that is scheduled with some representatives of the Loft, representatives of our county LGBTQAI advisory board to talk about how we can make sure that we reach out to people in the LGBTQ community so that those that are concerned that they might be exposed to this disease would then have the information they know how to respond, and they would know how to move to get vaccinations if they feel that is necessary. We want to try to, as best as we can, address the need as it manifests itself. And if we find that this is much more widespread, if our 12 cases becomes much more expansive, then we are in direct contact with the state, County Health Department, to the State Health Department. Joan McDonald, our Director of Operations, Ken Jenkins, our Deputy County Executive, myself, will be reaching out to the state and saying we see a larger level of outbreak in Westchester County. Right now, with 12 confirmed cases, while that's a large number in terms of the other counties outside of New York City, it's still a relatively small number of active cases. And if we're getting doses that approach 1,000 doses, and we currently have only 12 identified cases, I think we're in a good proportion for the moment. We'll see what happens. We know that New York City's opened up some single-day clinics. We'll see what happens in terms of demand there. My colleague Steve Ballone, who's the county executive in Suffolk County, has opened up some clinics, and they've targeted some geography where they believe that the vulnerable community may be more represented as part of the general population. We don't think we have an equivalent geographical situation, so we're going to try to deal where the population centers are and through our centrally based White Plains clinic. Beyond that, I think the most important thing is for people to be as well versed on the disease as they can. Most people will consult the internet, try to get an idea, just as Dr. Amler said, of what some of the symptoms are beyond the rash, which will probably be the most visible example, but some of the other situations, and then try to determine whether you need to seek the assistance of your medical professional. And if you don't have a medical professional, then you contact one of the local institutions, whether it's a neighborhood health center. If you qualify for that, those who are indigent would look to those local neighborhood health centers, Mount Vernon, Greenberg, Open Door, Sun River Systems, and Peekskill, and be assisted there. If not, CareMount, West Med, all of those types of organizations are there to be able to help if you have those concerns. Hopefully, with the vaccinations available to us, we'll be able to address this situation as quickly as we can and resolve this as best as we can. We know that when we're dealing with a health issue, things change as we go along. As I said up front, we will adjust our strategies, and we will try to get as much resources as we can to be helpful. Keep in mind that, this may anticipate any questions that we get, the information that reports cases, that information is reported directly to New York State. And New York State does not release to us detailed information on the cases themselves. There's contact tracing that goes on for the cases, but when you're dealing with a relatively small number of active cases, the contact tracing system is not a county-structured one as we did with COVID, which became overwhelming when we hit the Omicron surge. So New York State does not release to us more detailed information on the individual cases. So if somebody said to me, where are the cases? We don't have that information. That information is not released to us as a county health department, as a county government. So we can't tell you where they are. We don't know where they are. The state does. And if and when they feel that they need to inform us of something because of geography, we will deal with that. But when it's an airborne illness, geography matters. When it's a skin-to-skin contact, that can happen anywhere in a county. It's not necessarily tied to a geography. So therefore, we're less concerned about the geography, the zip code, the things that we talked about in COVID in this particular outbreak. I think I've touched on most of the major points that I wanted to make. Dr. Amler, have I missed anything that you think I should include?
No, sir.
Okay, very good. So we'll open it up. We have in-room press that's with us here, so they get the first crack at it. Any of our friends from the Journal News or from any of the television stations that are here, if you have any questions, we're happy to take them here. And if not, do we have any coming from remote? No. Okay, very good.
One question.
Yes.
So this is, you said it's been around for 50 years. Why suddenly are we seeing cases now?
Dr. Amler?
Well, I mean, the world is a smaller place than it was 50 years ago. You know, you can get on a plane and be anywhere in the world. Is that a part of it? Maybe. I don't think we exactly know the answer to that question. I think the good news is that this is not COVID, and the general public does not need to be panicked, and they don't, this is just different. It's not airborne. If I had monkeypox, no one in this room would have to worry about it because, you're even though you're breathing my air, unless there is some very slight concerns about droplets, but that's in people who are living with another person for prolonged periods of time. But in general, unlike COVID, where I would have to quarantine everybody in this room if we were here for a certain amount of time just because we were breathing the same air, that is not how monkeypox spreads. It is skin to skin, where you have a lesion, someone touches it, or the lesion touched an item and then they touched that item. So totally different mode of transmission.
I would just say one other thing, too, as an addendum to it, just from a layman's standpoint, that I think COVID has sensitized us to matters of communicable diseases. And I think now, because we're coming in the aftermath or the continuing reality of COVID, any disease that pops up that breaks through the public perception that may have been in existence before. We may have had any number of cases of a particular disease, but now we're going to be focused on it because COVID has made us more focused on it. And if we do see any other disease that comes up to some level of volume, it may have been there all along, but because of the sensitivity, then we felt the need to highlight it, and we will do that as we go forward. Any other questions?
If I could say one last thing.
Yes, please go ahead.
I think, the difference here is that we have the potential to prevent disease. So unlike with COVID, if you were exposed, me giving you the vaccine was not going to stop what happened. But with this particular disease, we have the ability to do post-exposure prophylaxis, meaning that we have a window of opportunity. And if we can get to that person during that window of opportunity, we can either prevent the disease from occurring totally, or we can mitigate the severity of the disease, meaning less symptoms, less severe disease. So that's why it's important that if people have an unusual rash, something that is very concerning to them, they do need to see their doctor, because if they can tell us who they exposed, we may be able to prevent them from getting disease. That's totally different than COVID.
Thanks. Dave McKay-Wilson from Journal News.
Yes, and I have a question that's not on the monkeypox.
Well, we'll do that separately
We'll do
then.
that separately?
We'll do that separately. Any other issues we can talk about separate from the press conference. Thank you all for coming. We will keep you posted. We have the Monday updates that we routinely do at 2 o'clock, and we'll certainly give you an update on those dates, and if there's anything else to report on sooner than that, we'll be happy to do that. Thank you for coming. Thank you for your interest. Have a good day.